Today I discuss how stressful emotions can cause heart diseases. And I'm joined by Dr. Azmee Ghazi.
Hi everyone.
So he's a consultant cardiologist and heart failure specialist at the Institut Jantung Negara and also an advisor to Naluri. And we're both training for Ironman triathlon races if they ever will resume races one day. Now, for thousands of participants of Naluri's digital health program, we measure and quantify both stress, anxiety, and depression levels, as well as physical health markers of weight, blood pressure, cholesterol, and blood sugar. And we see a strong correlation between those with high levels of stress and anxiety and those with high blood pressure and health problems. So, Dr. Azmee, right, when we're under constant repetitive stress, right, from pressures at work, family and marital difficulties, financial problems, having to care for aging parents or young children, or even just loneliness, what happens to our body physically?
Hi Azran. When we are faced with stressful situation, it triggers our body to respond physically. Hormones flood our body to prime it to react to the situation. Our heart beat faster, our lungs are expanding more to take in more oxygen, and our muscles are conditioned for action, essentially to fight or flee. However, if the stress is continuous and does not go away, the continuous surge of hormone causes inflammation and clogs up artery, a condition called atherosclerosis. The accumulation of fatty plaques inside blood vessels also contains monocytes and neutrophils, our own immune system, which will cause inflammations of the wall of the vessels and leads to blockages. Blockages can happen in the major arteries of our body. If it's left untreated, in the heart it can cause heart attack or myocardial infarction and heart failure. In the brain, causing stroke, and also in our legs, causing peripheral artery disease. Prolonged elevated heartbeat causes hypertension or high blood pressure.
Wow. So what are the symptoms or warning signs?
The symptoms can include restlessness and mood swings. Headaches are common, migraine, and also depression. Difficulty sleeping, for example. And some patients can get palpitations and also dizziness. The other thing that we also worry is reduced concentration, memory, impaired memory, and some people can get gastro disturbance, for example, diarrhea, they can get constipation, and they can actually lead to gastric ulcer as well. Weight gain is common, and also high blood pressure as well. And in some patients, they get chest pains and also difficulty in breathing.
So how do we prevent that stress buildup and take better care of our heart?
I think most importantly is to eat healthily.
Okay.
And a well-balanced diet, rich in fruits, vegetables, and also whole grains. Exercise regularly, every day. You don't have to train for an Ironman, but what you have to do at least 20 to 30 minutes every day.
Right.
And the movements that you need to do is, for example, a brisk walk or also a slow jog. I think that's very, very important. Avoid smoking and also alcohol, as they are stimulants and they will amplify some of the symptoms of stress or make us less aware that it's hurting our body. Quiet time is important, for example, prayers, meditation, relaxation, reading is important, and also do some pleasurable hobbies and socializing with some friends. I think that's also important. Regular annual checkup is important.
Okay.
And it is also recommended if it's above 40 years old, okay, that you have to do a regular medical checkup. And if you have heart disease, then we may have to prescribe some medications to control the abnormal heartbeat or hypertension associated with the stress.
So thank you for sharing. Now finally, what are the trends you are seeing with your patients at IJN?
The most worrying trend is the patient who's suffering from heart attacks are getting younger, even as early as late 20s and early 30s. Yet, those could mostly be preventable if they will conduct medical checkups earlier instead of waiting until at the end of collapse before seeking medical attention. I think that's very important. Another worrying trend is not taking medication as prescribed. When patients do not take their blood pressure medication, especially when they feel better, when they initially take their medication, this will dramatically reduce the effectiveness of this medication. For it to work, we need to take it consistently, and this is actually to try and retrain our body hormones and organs to rebuild. And you should only stop or change your medication with consult of your own doctor.
Wow, okay, well, thank you very much. These are very useful reminders for all of us. And as always, let's keep things positively personal.